Hi guys, my name is Molly. I am a registered nurse and I work in psychiatry and substance use. I've been doing that for the last 5 years. I did a year at a treatment center prior to that. So I've been a nurse since 2017. And I just finished 2 years in a doctorate program, DNP program, um, at another school. But between being a single mother, working full time, and going to school, it was too much to juggle everything. So I ended up finding WGU, and I'm glad that I did because it's a course or a program that fits my needs in terms of what I'm able to do in moving forward. But I do have quite a bit of experience in the field of psychiatry, and I am really enjoying this course so far and learning a lot about the professional presence and mindfulness. In terms of mindfulness, what's interesting is I do a lot of self care to begin with. I have a background personally in recovery and with my spirituality, and I hadn't realized prior to this course just how beneficial mindfulness can be and how much you can incorporate it into practice and the things you're doing, like in the office and with your patients. And since I've taken the time to be more mindful, I found myself much less stressed at work, and I've been able to catch up on some things I was behind on. And I also learned quite a bit too in terms of the verbal and nonverbal communication and the active listening and communicating with my coworkers. I hadn't noticed how much I had deficits in those areas, and it made me really take a look at how I was showing up in a professional manner and where I could grow and where there's still room for improvement and where my strengths are. I'm really strong when it comes to working with my patients, but I have a lot of anxiety when it comes to working with peers and coworkers and authority figures, and that's an area where I need growth. So this course has really helped me to take a look at how I can grow in those areas and steps I can take to do that. I chose to update. I had a LinkedIn profile previously, and again, I was surprised to see it's been a while since I've updated it. So I chose to update that, and I changed my picture to make it be something that is more recent. It's a headshot that was used for my email at work not too long ago. And then I updated my most recent educational experiences and made sure that the work experiences included the things that were on my resume. And in the part of my profile description, I put in my professional vision that I had created when I was doing a doctorate program, which incorporated a lot of the things that are talked about in this course in terms of professional presence and mindfulness. In my professional vision, that hasn't changed, even though the path that I'm taking to eventually get a doctorate, I'm working on my master's, and I do plan to finish a doctorate eventually. Even though the path I'm taking has changed, my professional vision hasn't. I am huge on authenticity and showing up, and basically what you see is what you get, and being that whole person and treating people with that holistic frame of care, body, mind, spirit, emotions. It all matters. Looking at that backstory, that hidden message when you have a patient in front of you, what they're saying and what they're not saying, and what's really going on, and getting to the bottom of it. And I included my list of values that I really strive to emulate in my daily practice, and ones that I sometimes do fall short in, and I am aware of and I look for on a regular basis. And those values include honesty, authenticity, integrity, grace, advocacy, education, self awareness, creativity, humility, courage, caring, compassion, empowerment of clients, respect for individuals, diversity, equity, and inclusion. And as far as the second question goes, engaging in a professional community, I definitely find that to be I find communities to be an awesome resource for connecting to other nurses and other advanced practice nurses and nurse practitioners who have experience in the field. I have been a student member of the American Association of Nurse Practitioners and the Illinois Society for Advanced Nurse Practitioners for the last 2 years, and I get emails every couple days with the latest hot topics that are being discussed or voted on, latest evidence-based practice changes, stuff like that. And so it helps me to see what's going on in the field, what's being talked about, if it's something that I want to help advocate for, if it's something that I want to learn more about or need to learn more about. And then the events that are held, I haven't had a chance to really go to any, but their opportunities to network and connect and also make my presence known. So that way, when it comes time for me to look for a preceptor for clinical hours or look for a job, I'm able to have those resources in place and those people that know me. And I've been really, really fortunate in the place that I work. Like I said, I work very closely with our nurse practitioner. Over the last 5 years, she's kind of taken me under her wing and taught me everything that she knows in terms of diagnosis and treating and her algorithms for prescribing medications. I've learned all of that in the way that she holistically cares for our clients. But I know that every provider kind of has their own angle that they take things in perspectives, and I want to learn different things. So I am really looking forward to getting out there and connecting with. I do know quite a few people who are advanced practice nurses in the field, and I want to connect more with them and get to know some other perspectives and some other ideas. So that's really it. I am grateful for the opportunity to share today and look forward to getting to know some of you. Thank you.